Welcome now to the wrist section of the hand and wrist x-ray course, and we will start this section like last section with an anatomy review. The bones of the wrist are called the carpal bones, and they connect the metacarpal bones of the hand with the bones of the forearm, with the bones of the forearm being the radius and the ulna, as shown here. There are 8 carpal bones, and they are split into 2 rows, and the proximal and the distal rows each contain 4 carpal bones. So from radial to ulnar, so starting at the thumb side, we have in the proximal row the scaphoid, the lunate, the triquetrum, and the pisiform bones. And then in the distal row, also starting at the thumb side, we have the trapezium, the trapezoid, the capitate, and the hamate. The capitate is the largest carpal bone, and it sits just in the center there. The order of the carpal bones can be remembered by the R-rated mnemonic device. Some lovers try positions that they can't handle. And so that goes through the proximal row, radial to ulnar, and then the distal row. So you start with scaphoid for some lovers try positions that they can't handle. And then you can also remember that trapezium rhymes with thumb, and they articulate together. The proximal row, as shown in green here, is the row that articulates with the radius to form the wrist joint, also known as the radiocarpal joint, radio for radius, carpal for the wrist bones. The scaphoid is named after the Greek word for boat because of its boat shape, and we'll see that better in just a moment. It has the most amount of articulation with the radius. The lunate beside it is named for its crescent or moon-like shape, which we can also see better in a moment on the lateral view. And lunate is like the French word lune for moon. And then finally we have the pisiform, and that is named because it resembles a pea, because it is a very small and round bone that's embedded in the flexor carpi ulnaris tendon on the volar side of the triquetrum. Thus, the pisiform is essentially a sesamoid bone, recalling the definition of a sesamoid bone as a bone that is within a tendon or muscle, and it does not contribute to the wrist joint. It's also worth noting that the ulna also does not contribute directly to the wrist joint and does not articulate with the carpal bones. The distal row of the carpal bones articulates with the metacarpals, as seen here. So the trapezium articulates with the thumb metacarpal, the second metacarpal with the trapezoid, the third with the capitate, and then the fourth and fifth both with the hamate. Between each of the carpal bones, there are strong ligaments connecting them together, as well as to the metacarpal bones. Because of how tightly the distal row is connected to the metacarpals, there's not much motion here, and so most of this wrist motion comes from the proximal row, where the carpal bones articulate with the radius. So here's a normal x-ray view of the carpal bones, and just take a moment here to pause the video and try to identify the 8 carpal bones on this view. So here are all of the bones labeled, so we'll go over them. So you can see the scaphoid here is on the thumb or radial side of the wrist, and you can see that it articulates the most with the radius, which is the major contributing forearm bone to that wrist joint. The lunate is beside it, remembering the mnemonic, some lovers try positions that they can't handle. So you have the lunate here, and then you have the triquetrum and the pisiform. You can see that the pisiform really overlaps quite a bit there, and it's that small round P shape. Then in the distal row, we have the trapezium, rhymes with thumb. The trapezoid overlaps normally with the trapezium in this view, and then the capitate here is that the biggest bone out of all the carpal bones, and then finally you have the hamate. You can even see there's a little outline there, and that's the hook of the hamate. Note that it is also normal to have this large gap between the ulna and the carpal bones because the ulna does not contribute to the wrist joint. We're just going to look a little bit closer at the distal radius as well. So in particular, the distal radius has 3 spots that articulate with other bones. So as we talked about, we have the scaphoid. So the scaphoid fossa shown here and here is where the scaphoid sits and articulates with the radius to form the wrist joint. You can see that it's the bigger fossa out of the two. It has the biggest articulating space. Beside it, some levers, we have lunate fossa there. And then finally, we have the sigmoid notch. And that's where the radius articulates with the ulna, which is the other forearm bone. The articulation between the radius and the ulna is also called the distal radio-ulnar joint, or DRUJ, drudge for short. There is also a proximal radio-ulnar joint at the elbow, but we will not go into that today. When reading any type of x-ray, it is important to trace the bony contour of each carpal bone to look for fractures, as fractures are what we're most commonly looking for in a trauma setting. Here is an example of a fracture as seen by the bony contour abnormality in the scaphoid. So this is that boat shape that we were talking about. The scaphoid is named after the Greek word for boat, and you can see in this radiograph the boat shape, and there is a crack right in the middle there. And then you can see where it articulates with the radius, and then the lunate beside it with the radius as well. So in addition to fractures, when we're examining the carpal x-rays and looking for abnormalities in the carpal bones, we want to look for 4 A's. We want to look at arcs, angles, articulation, and alignment. We will start with the arcs. So the 2 carpal rows can be seen on x-ray, and they create 3 smooth borders called arcs or Gilula lines on the anterior-posterior x-ray views if they're in a proper position. The Gilula lines are named after Dr. Louis Gilula, which these images are taken from his original paper about these arcs. The first arc is created by outlining the proximal row where the wrist joint is. So you can see right here the proximal row outlined in black here. Obviously, it isn't perfect with the pisiform sticking out a little bit embedded in the flexor carpi ulnaris tendon, but you can see how there is a more or less smooth curve with the scaphoid, the lunate, and the triquetrum. The second arc is created by outlining the other side or the distal border of that same proximal row. So that's the second line there. And then the third arc is created by the proximal border of the distal row. So it's very close to that second curve. However, the third arc basically ends at the trapezoid bone there, and it only traces the hamate and the capitate. So the hamate and the capitate. On x-rays, these 3 arcs can be seen as 3 smooth curves. Wrist arcs are very useful when examining x-rays to help in identifying carpal misalignment. So for example, in this image, you can see that there's disruption in the Gilula arcs, and so you can see that it's the red line. It's not one smooth border there as the first line, and then the second and third are quite jumbled here with no smooth arcs at all. And so then that can indicate an injury, usually a carpal dislocation. There should be, in general, no obvious step-offs like this. This is another example, and it becomes very difficult to even start to trace the lines because you see there's really significant carpal misalignment and no nice Gilula lines there. Another important thing to pay attention to are the angles in the wrist. So the 2 most important angles involve the radius. In a PA view, there's a concept called radial inclination, which refers to the radius extending by about 15 to 25 degrees past straight. So you can see here how the radial styloid kind of extends beyond a 90-degree angle with the wrist joint and almost cups the scaphoid. So the way that you can measure this is you can draw the long axis of the radius and then perpendicular line to that, and that represents the wrist angle. And then the radius should have extension beyond that, 15 to 25 degrees. So if that's disrupted, then that can indicate pathology like a distal radius fracture. Then similarly, on the lateral view, there's another important angle with the radius. There should be a volar tilt of the radius of approximately 10 to 25 degrees here. You measure it similarly, so you measure a straight line down the long axis of the radius and then add a 90-degree angle to that. And then to measure the volar tilt, you see the volar lip of the radius and then the dorsal lip of the radius, and that creates your angle there. that you expect to be 10 to 25 degrees. Changes in these angles are important in the context of distal radius fractures, especially because if the angles are too disrupted, it can mean surgical management. There are other angles in the wrist that can be measured, but those fall beyond the scope of this course. Next, on a radiograph, look at the articulation, which is the distance between all of the carpal bones. All of the carpal and metacarpal bones should be separated by around 1 to 2 millimeters. Any closer or further may indicate injuries such as dislocation or soft tissue injury. The exceptions are where we've already discussed that there is overlap normally, such as with the pisiform and the pisiform there, and with the trapezium and trapezoid there. And so you can see another example here of 1 to 2 millimeters everywhere, except for here. Normally, between the scaphoid and lunate, you'd expect 1 to 2 millimeters, as you see here. But here it is obviously quite a bit larger than 1 to 2 millimeters, and that indicates an injury. Finally, the alignment of all the carpals together should be correct. For our purposes, the only important alignment to check is on the lateral view. So it is important to make sure that the radius, the lunate, and the capitate are all in a straight line with the cup in a saucer appearance. So you can see the radius here, and the lunate, that moon-shaped carpal bone in the proximal row, sits nicely in its lunate fossa, and then it's like the saucer holding the cup, which is the capitate, which sits directly on top of it. You can see this on the x-ray as well. So you see that radius creating the nice cup for the lunate, which is outlined there, and then the capitate is nicely sitting in it as the largest bone of the carpal bones. So this concludes the introduction to anatomy and reading wrist x-rays. Next, we'll move on to several common pathologies.